The White House released its plan to help kids fighting chronic diseases. The Make America Healthy Again report details 128 strategies, but it lacks extensive details. It focuses on ultra-processed foods, microplastics, chemical exposure, and increasing physical activity. Health and Human Services Secretary Robert F. Kennedy Jr. touted this report as, quote, unprecedented.
All the disparate groups that were studying little different silos of the health crisis are now consolidated, and they have a clear outcome in mind, which is to end chronic disease in our children, and it's measurable.
Rachana Pradhan is a health news correspondent for KFF, and she joins us now to speak about what this really means. Rachana, good morning. Thanks for being with us.
Thank you.
What are some of your main takeaways from this report? And we mentioned that it lacks specifics. How is that so?
Right. I mean, the report is only about 20 pages long, and so it proposes a lot of very big ideas, but it lacks detail, and details on funding included, like how is this really going to be accomplished and how is it going to be paid for? The report has a lot, I think, that would appeal to people across the political spectrum because of its focus on children's consumption of ultra-processed food, lack of physical activity, chronic stress, and even exposure to chemicals that may be compromising their health. But there are pieces that are definitely being met with some consternation, even among those in the MAHA movement, and we can discuss those more shortly.
You know, a lot of experts will say these recommendations should be based on science, based on factual reports and information. The report itself is less critical of pesticides, though, and more critical of vaccines. What does that tell us?
Well, I think on pesticides, Secretary Kennedy does work for a Republican administration, and traditionally Republicans in Washington have been loath to propose new regulation on industry. And I think also Republicans in Congress were a little concerned, some from farm states, that you would be proposing additional regulation on the agricultural industry, which is a huge economic engine and employer in those states. And so it doesn't propose new regulation of pesticides, which is something that Secretary Kennedy, previously was a big supporter of. I think that is a disappointment to MAHA activists. Now on vaccines, the report is a reflection of Secretary Kennedy has been a longtime anti-vaccine activist and proposed, he's disseminated disinformation about vaccines and cast doubt on their safety and effectiveness. And this report, I think, reflects that predisposition and those of many of his supporters who greet vaccine mandates and many of our immunizations with skepticism, if not outright opposition.
And in our last few seconds, critics are pointing out that there's no mention of gun violence. Accidental gun deaths is the leading cause of death for children in the U.S., as well as food insecurity. What do you make of that?
Well, I think, again, the MAHA report proposes a lot of strategies that will secure a lot of support across the political spectrum. But at the end of the day, Secretary Kennedy works for a Republican administration, and I think they would be reluctant to do anything that would bring up gun violence because of how that would register with their political base. And also food insecurity is something that many people have mentioned, but the recent law that President Trump signed on taxes and domestic policy makes big cuts to programs that often provide food security to low-income Americans. And so I think that is likely why the report did not include those things.
Well, Rachana Pradhan, we appreciate you waking up and joining us this morning to talk about this. Thanks for your time.
Thank you.